for brain tumor, it's hard to give you a snapshot because there are different types of brain tumors. They were different grades and so on. So I'm only presenting the Canadian data. There will be a lot more information in the full paper, but there were 7 Canadian incidence studies. Again, these had to be published papers that were peer-reviewed, so there's a lot of registry data that's not included. But basically, the overall incidence you can see in children is about 3 to 4 per 100,000, and for all age group about 11. For cerebral palsy, again, more information in the paper, but what you can see is that over time the prevalence of cerebral palsy is about 2.1 per 1,000 live births. And you can see the graph on the right-hand side that we have the studies listed over time, that the prevalence is not changing very much. I think what's most dramatic is that, of course, the prevalence is much higher in those who are prematured. So you can see less than 28 weeks, it's almost 80 per 1,000 children, whereas if they're born over 36 weeks, it's much better, and by birth weight. So you can see that definitely if prematurity can be prevented, that's important. So moving on to the second objective, we had to summarize how are patients identified for surveillance purposes for each of the conditions. So what we did initially is that we did a systematic review of looking at which condition could be identified using administrative data, which are data that are created when a patient sees a physician. We submit we submit a billing claims. If a patient comes to hospital, to the emergency, all these data are captured in administrative data. So we did a systematic review, and what you can see is the 15 conditions are listed at the top. And if you go all the way to the bottom, you can see, sadly, there are very few studies that have validated